He told me he hadn't cried since he was 9 years old. Said it like it was something to be proud of. And then I uncapped the syringe, and suddenly he was very interested in studying the ceiling tiles. I didn't laugh. I wanted to, but I didn't. His name was Daniel, late 30s, broad shoulders, the kind of guy who probably opens jars without being asked and carries all the groceries in one trip. He'd shown up at the urgent care clinic where I was doing my rotation on a Tuesday evening, referred by his primary care physician for a B12 injection. Routine. Completely routine. Except nobody had told Daniel that, apparently, because he walked in holding his referral slip like it was a summons to something deeply unfair. The waiting room had that particular evening smell, antiseptic with a ghost of someone's takeout coffee underneath. The fluorescent lights were doing their best. I was doing mine. I introduced myself, asked him to take a seat, and watched him choose the chair farthest from the supply cart. Noted. "So," I said, pulling on my gloves. That familiar snap of nitrile, the slight resistance, the way they fit like a second skin. "Have you had an intramuscular injection before?" He looked at me, then at the cart, then back at me. "Define before," he said. I liked him immediately. We talked for a minute. I always do that, not to stall, but because it matters. A person who's braced for pain is a person whose muscles are already tight, already working against you. And a tight muscle makes everything harder. The needle meets resistance, the medication disperses unevenly, and the soreness afterward is so much worse. So I talk. I ask questions. I let them answer. And while they're busy forming sentences, their shoulders drop about half an inch. And that's exactly what I need. Daniel told me he'd been exhausted for months. Foggy. His doctor had run a panel and found his B12 was low. Not dangerously, but enough to explain why he'd been falling asleep reading and forgetting words mid-sentence. B12 deficiency is sneaky like that. It doesn't announce itself dramatically. It just quietly dims the lights on you. And oral supplements help some people, but if absorption is the issue, which it often is, especially as we get older, an injection bypasses all of that, goes straight into the muscle, straight into the bloodstream, efficient, reliable. "It sounds worse than it is," I told him, and I meant it. "You say that," he said, "but you're not the one getting poked." "Fair point," I said, "but I am the one doing the poking, which means I have a vested interest in making it go well. My reputation is on the line here." He almost smiled. Almost. I asked him to roll up his sleeve, and then I paused. Because, actually, for a B12 intramuscular injection, the deltoid is a perfectly good site, but I always assess first. The deltoid, that rounded muscle at the outer upper arm, is ideal for smaller volumes, and B12 injections are typically just 1 milliliter, so it's a good fit. I checked his muscle mass lightly with 2 fingers through the fabric before he rolled the sleeve. Adequate. Good. Once the sleeve was up, I cleaned the site with an alcohol swab, small circles outward, and then I let it dry completely. That part matters more than people think. Injecting through wet alcohol stings. It's such a small thing to wait for and such a noticeable difference. "Look at the wall," I said. "Not at me. Not at your arm. Just that poster over there. What does it say?" He squinted. "Something about hand washing?" "Read it to me." "Are you serious?" "Completely." He started reading, slowly, a little reluctantly, and while his voice was occupied with the importance of proper hand-washing technique, I positioned the needle, 23 gauge, 1 inch, standard for deltoid IM, at a 90-degree angle to the skin. Not angled, straight in. That's the thing people get wrong in their heads. They imagine some kind of diagonal approach, like you're sneaking up on the muscle. You're not. You go straight, with confidence, with a single smooth motion. I inserted the needle. He didn't stop breathing. I aspirated briefly, just a moment, just to confirm placement, then pressed the plunger slowly, steadily. The medication went in over about 10 seconds, not rushed, never rushed. Speed is where people feel it. I withdrew the needle in one clean motion, pressed a small piece of gauze to the site, and said, "Done." He stopped mid-sentence about the importance of scrubbing between your fingers. "That's it? That's it." He looked at his arm like it had betrayed him by not making a bigger scene. I was reading about hand washing. "I know," I said. "That's why." There was a pause, and then he laughed. A real one, surprised out of him. And I pressed the gauze a little more firmly and told him to hold it there for a moment. No rubbing, just gentle pressure, because rubbing can cause the medication to track back toward the surface and lead to irritation. Just hold. He held. I disposed of the needle immediately. Never recap, never set it down, straight into the sharps container in one motion. That's not just protocol, that's muscle memory. That's the kind of habit that keeps everyone safe, including me. "You might feel a little sore there tomorrow," I said, pulling off my gloves. "Like you slept on it wrong. That's normal. If you notice any redness spreading, or it feels warm to the touch after a day or two, that's worth a call to your doctor. But honestly, most people feel nothing." He nodded, rolling his sleeve back down with the careful dignity of someone who had survived something and wanted credit for it. "Can I ask you something?" he said. "Sure." "Does anyone ever actually pass out?" "Sometimes," I said honestly. "Usually it's the anticipation more than the needle itself. The body gets so wound up preparing for pain that it just overreacts. It's called a vasovagal response. Your blood pressure drops, you get lightheaded, sometimes you faint. It's not weakness. It's just the nervous system being dramatic." He considered this. "So I was at risk." "You were at moderate risk," I said. "You had the ceiling staring thing going on." Another laugh, easier this time. I gave him the aftercare instructions. Keep an eye on the site, stay hydrated, don't be alarmed if he felt a little flushed or warm in the next hour. That was just the body processing the injection. And I mentioned, almost as an aside, that if he ever needed to monitor something like a low-grade fever at home, the most reliable method is still a good old oral thermometer. Under the tongue, lips closed, 3 full minutes. Not the forehead strips. Not the ear ones if you're not trained in positioning them correctly. Oral, when in doubt, gives you the clearest reading for adults. He thanked me, stood up, and then at the door he turned back. "For what it's worth," he said, "you have a very calm voice." I smiled. "I've been told." "Does it work on everyone?" "Almost," I said. He left. The door swung shut behind him with that particular soft click of a well-fitted frame. I stood there for a moment in the quiet of the exam room. The hum of the ventilation, the faint antiseptic smell settling back into stillness. And I thought about how strange and lovely it is, this work. The trust people extend to you in that moment. A stranger, rolling up their sleeve, looking away at a poster about hand washing because you told them to. The way a person's whole body can soften when they realize the thing they feared is already over. There's something in that I never get tired of. The needle goes in and the fear goes out, and for just a second, Just one quiet second. Someone lets themselves be taken care of. That second is the whole reason I'm here.